Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Topic for the day is PCOS, Polycystic Ovarian Syndrome, or some of you may be calling it as PCOD or Polycystic Ovarian Disease. Both are same. There will be no difference. Polycystic Ovarian Syndrome or Polycystic Ovarian Disease is a common disease within females in their reproductive age group. Reproductive age group starts from 15 years to 40 years. In this age, due to hormonal imbalance, this is a very common disease in the females. Previously, it was thought the prevalence of the disease was only between 4% to 18%. Now, in the urban setup, this incidence has risen up to 26%. In the reproductive age, in urban setup, almost all the women has up to 26% of the prevalence. What is that making this disease different from other diseases is it is directly related to the mate value of a female. Mate value means every female will have a value, that value is going to be decreased because of what? So beauty is a paramount or the most important thing for a female. Because of this is that is directly hampered, and also the reproduction because of infertility is one of the major cause symptoms of this disease. So even though the female is married, she is heading towards divorce because lack of children. So the first thing is obesity and also unwanted hair on the face and other parts of the body. This is making them look like a male. Acne around the face and also other parts of the body. There will be dark patches on the skin, especially on the neck and the folds of the skin where the joints holds like axilla, popliteal fossa, and in the arms. So all these places there will be black velvety discoloration of the skin in the folds. And also because of all these things, the female is landing into depression. So reduced mate value, infertility causing heading towards divorce, and depression are the major reasons that is making this disease different from other diseases. We have seen lot of patients where even after taking the treatment for 6 years to 10 years, there is no improvement in their condition. What I mean by allopathy is when you have this disease, you will go to a corporate hospital or to a gynecologist and get treated for this. Even after getting treated for 10 years, there will not be any improvement and there will be further derangement in the condition. But in homeopathy, you have very good treatment for this. All the conditions can be completely reversed. If you are infertile, we can make you fertile, and if there is discoloration of the skin, it will be completely cleared. Your acne will be cleared. Your unwanted facial hair and the hair in other parts of the body can be completely reversed. Obesity can be decreased. By improving all these conditions, your mental condition is also increased. You will be out of depression. You will again feel young, and you will feel your mate value will be increased. For that, the only thing you have to do is you have to consult us. There will be complete treatment. We call it as constitutional treatment along with symptomatic treatment. We combine both and we deploy it to you without any side effects, very effectively, with affordable treatment. And along with the treatment, there will be certain tips we will be saying to you in how to eat, how to exercise, how to sleep, and how to reduce the stress. If you take the treatment along with these 4 steps, you will have a greater chance of reversing the PCOD completely and becoming a high value female again. It is important for a reproductive age female to know about the investigations in polycystic ovarian syndrome, because with the investigations we are able to detect as early as possible and start the treatment. First one you have to get it done is ultrasound abdomen. In ultrasound abdomen, you can see the ovaries enlarged. Around the ovary, there will be a pearl chain-like structure where there will be follicles. It looks like a pearl chain. This is a very important sign. Next one is when you check the blood glucose levels, they will be abnormally high. Either fasting blood glucose or random blood glucose, any of the glucose will be very high. Apart from that, you have to also check HbA1c. It will give you the sugar levels for the last 3 months. Next one you have to do, if you are suffering from this for a very long time, is you have to get it done for endometrial biopsy, because one of the complications of PCOS is endometrial cancer. We have to rule out that, so that you have to get it done for endometrial biopsy. We should also be looking into lipid profile, because there will be elevated levels of LDL and decreased levels of HDL, which we call as hyperlipidemia or dyslipidemia. And also we have to check for hormonal levels. We call it as hormonal assay. Either luteinizing hormone is high, estrogen is high. So what are all the abnormalities within the hormones? We have to have clear cut idea on this. Apart from all this, how do you diagnose a person or a female, a woman is a PCOS? You have to satisfy two criteria within this three criteria. First one, you should have amenorrhea. Amenorrhea means absence of periods or delaying of periods. Next one is hirsutism. You should be having unwanted hair on the face or any part of the body. Apart from this, you have to also check for pearl ring like structure, pearl chain like structure, ovaries. So if you have any two of the signs within these three, it is considered as polycystic ovarian syndrome. As a reproductive age female, it is very important for you to know about the structure of ovaries and structure of reproductive system, and also functional and physiology of reproductive system. Coming to the anatomy, each female will be having one uterus in the pelvis. From the uterus there will be two fallopian tubules, tube like structures coming out, and at the end of each fallopian tubule there will be ovaries. These ovaries will have eggs. These eggs will be released every month in ovarian cycle. So this is the structure of female reproductive organs. Consider that you are having a menstrual cycle of 28 days. What the ovaries or the uterus or the hormones released by these structures will be doing for these time, for 14 days, first 14 days is it is preparing for you to have fertilization. So at the end of 14th day, if the ovary is fertilized, the pregnancy will continue and hormones related to your pregnancy will be going forward. If the fertilization doesn't occur on 14th day, these products which are developed or the endometrium which is proliferated within these 14 days will undergo shredding through menstrual cycle. From the menstrual blood, the endometrium will be shed off and it will be preparing you for the next reproductive or next menstrual cycle. Next thing you have to understand is what is the reason for PCOS. After doing a lot of research, they have concluded that there is no reason for PCOS, but there exists certain risk factors for it. First one among is obesity and also insulin resistance. You know, insulin resistance and obesity go hand in hand. If you are obese or if you have insulin resistance due to obesity, you are more risk of getting PCOS. Coming to the pathology of PCOS, the first thing we will be noticing is insulin resistance. Because of this insulin resistance, even though there is high levels of insulin in the blood, the glucose is not moving into the cells and the glucose levels will be elevated. This will be causing hyperlipidemia and also other things, other pathological changes related to hyperlipidemia. Next one is there will be high levels of luteinizing hormone. This luteinizing hormone will stimulate the theca interna. This theca interna will produce more androgens. Because of this more androgens like testosterone, you will be having more facial hair, unwanted hair on the body, and also there will be change in the voice. You will get the voice more hoarse. These androgens will be moving towards the periphery and they will be depositing in the subcutaneous fat. In subcutaneous fat, these will be converted into estrogens. Then you will have high levels of estrogen in your blood. When there is high levels of estrogen, there will be endometrial proliferation within the uterus. If this is not controlled, this may lead into uterine cancer, endometrial uterine cancer. What is the conventional treatment or allopathic treatment for PCOS? When you suspect that you have PCOS and you go to a corporate hospital or a gynecologist, the treatment which they are going to do is conventional treatment or allopathic treatment. Whatever the treatment they give, they will be giving hormones. So the artificial hormones they will be giving, these artificial hormones has lot of side effects. The main side effects you are going to see is you will be landing into cancers. On top of it, even though the treatment is continued for 5 years, 6 years, up to 10 years, there will not be improvement to your condition. There will not be permanent cure. Allopathic treatment is not best in the case of PCOS. Now we will look into how you can be benefited with homeopathy, Fidicus Homeopathy especially. So there is possibility for you in case of PCOS, it can be completely reversed with constitutional treatment. So we are going to give you constitutional treatment. If you take the constitutional treatment along with the changes, few changes in food habits, few changes in sleep, reducing the stress and also exercise, this PCOS can be completely reversed. So how this is possible? We use a treatment called constitutional treatment. In constitutional treatment, see, if any disease you get either from your genetics or from your habits, genetics or these habits we call as acquired. The combination of your genetics and your acquired symptoms is your disease. Because of these two characters, there will be three types of changes in your body. First change is at your physical level. Physical level means there will be changes in the physical structure. In this case, the ovary is enlarged, or there will be pearl chain like structure around the ovary, so you will be obese. These are the physical changes. And coming to the physiological changes, what are all the physiological changes? There will be imbalance in your hormones, or there will be digestion problems or some other problems, something related to physiological changes. And the next one is psychological changes. Because of all these things, you may undergo depression, or you may have anxiety, or any other psychological changes. Based on these three changes, we will be deploying you a constitutional medicine. When we give the constitutional medicine, all these changes will be reversed slowly, and we come to a point where these are completely gone. So complete cure is possible in homeopathy through constitutional treatment. Along with the constitutional treatment, we will also give symptomatic treatment. Symptomatic treatment is based on your symptom. For example, 10 of you are suffering from PCOS. 10 different people will have 10 different symptoms. Based on your symptom, we will use symptomatic treatment also. For example, some will have delayed periods. Okay, we will have separate medicine for delayed periods. In the same way, some will have early periods. In some, the periods are painful. In some, the periods are not painful. Some, the periods are prolonged. They may have for 10 days or 15 days. Some, they will be scanty, only 1 day or 2 days. In some, the blood flow will be very scanty. You can just spot a few drops of blood. In some people, or in some of you, it will be huge and copious amount of blood. Based on each symptom, we will be giving another drug for you, so that that particular symptom is reduced. Apart from this, there is a condition, acanthosis nigricans, where the folds of your skin or the neck will become blackish yellow purple discoloration. For that, we will have separate medicines as well. And also hirsutism, where unwanted hair is developed on your face and also in your body, we will have separate medicines for that, along with the constitutional treatment. If you are infertile, we will identify the cause for the infertile, what exactly happening, and we will give separate medicines along with the constitutional treatment. If you are obese, there are excellent medicines in homeopathy to reduce your weight, along with few other tips. And also, if you are in depression, or if you are anxious, based on what type of anxiousness it is, what type of depression is it, what is it exactly causing, we will deploy a special medication along with the constitutional treatment, so that all your symptoms will be completely reversed. We have seen a lot of patients, even after taking the medicine with allopathic treatment for 10 years, their condition is not improved. But with homeopathy, you have greater chance of reversing all your symptoms and becoming a high value, beautiful female again. In homeopathy, PCOS can be completely cured, and we can prevent it from coming again and again. Mostly, it will be cure and prevention. If not possible, only in some of the cases where we are not able to completely cure it, there will be relief of the symptoms. That is only in very rare cases. All this can be done, whether it is cure or it is prevention or it is relief, without any side effects. Homeopathic medicines doesn't have any side effects. The reason for this is, the first reason is, see, in allopathy or Ayurveda or any other system of medicines, the medicine concentration will be given in few grams or milligrams. But in homeopathy, the medicine is given in only few picograms. Picograms means very, very less compared to grams and milligrams. That is picograms. And also, we use nanotechnology in homeopathy for making the homeopathic medicines. We use two type of technology. One is we call as trituration, and one is we call as succussion or froth flotation. So with trituration, each active ingredient will be surrounded by a lactose coat. On top of lactose coat, once with the technique of succussion or froth flotation and placing the medicine in a silicon container, there will be a silicon coat, so that the center active ingredient is well protected, and it is a nanoparticle. When we deploy these type of nanoparticles in very small quantity, there are no side effects, and these nanoparticles will go and act only on the target specific areas. There is no off targeting. When there is no off targeting and they will be acting only on the target, there are no side effects in the homeopathy. The two reasons is, first one, we will be giving very less medicine in picograms, and also we will be deploying target specific. There is no off targeting in homeopathy. That is the reason there will not be any side effects. And homeopathy medicines are very effective. See, even though we use the medicine in picograms, these are very effective. The reason is, homeopathic medicines work on the principle of hormesis. The principle of hormesis says any quantity, including water, take water. It in higher quantities, it will kill a biological activity. It will kill a person if large amount of water is taken. Or in medium quantities, it inhibit a biological activity. Snake venom, in medium quantities, it may not kill the person, or it will cause some damage to the person. That is medium quantity. And in small quantities, even if it is a snake venom, if it is given in small quantity, it works as an excellent medicine. So that we call as principle of hormesis. That is the reason in PCOS case, when we give small amount of medicine in picograms, the medicine works excellently because of hormesis principle. So the homeopathic medicines are safe, homeopathic medicines are effective, and homeopathic medicines are affordable. Why homeopathic medicines are affordable? Why homeopathic treatment is less costly than compared to any other system of medicine? Because in homeopathy there is no patenting system. Patenting system means, when one pharma company makes a drug, so only that pharma company can sell the drug for certain period of time to their decide on how much they want, they can charge it. As there are no patent rights in homeopathy, everyone tries to make the homeopathic medicine, so that there will be a competition and price will be reduced. So finally, homeopathy medicines are safe, homeopathy medicines are affordable, homeopathy medicines are very effective in case of polycystic ovarian syndrome. What are all the precautions that a PCOS woman has to take? It is very important. We will discuss. There are simple 4 points. The first point is diet. What type of diet a woman should take? She should take less carbohydrate food. So normally you will be eating once in morning, afternoon, evening, and night, and also you will be eating in between. Mostly you will be eating carbohydrate food. You have to cut down the carbohydrate food. Eat 3 times a day, if possible 2 times a day or 1 time a day. It is very good for you. So reduce carbohydrate as much as possible, so that your carbohydrate regulation and insulin regulation is increased. Next, take the food in very less frequent intervals, so that you will have long hours of fasting and your glucose metabolism is regulated. Next one is, cut down the saturated fats or fatty foods. When you cut down the saturated fatty foods or any other fatty foods, so your obesity will be decreased. Decreasing the weight of the female is very important in case of PCOS. Next comes the exercise. What type of exercise you have to do when you are PCOS? So the exercise you have to do is called zone 2 cardio exercise. In zone 2 cardio exercise, you can do brisk walking or cycling or swimming, but it should not be huffing and puffing. So the oxygen demand should not be increasing. The good measure for that one is, you can talk to your friend on phone, so that the friend can infer that you are on exercise, but you will not feel any difficulty. So there you should be breathing in from nose and breathing out from nose as well, not from the mouth. So you have to do medium intensity, so that your glucose metabolism is regulated. When there is no huffing and puffing, when there is in zone 2 cardio exercise, fat is a substrate for energy. You are burning the fat and producing the energy. If you are huffing and puffing or doing some higher intensity exercises, there you need carbohydrate. So here, fat is a substrate. Fat from your adipose tissue and from your visceral tissue, visceral fat and adipose fat is coming, and it is converting into energy, so that your fat metabolism is regulated. After that, next important thing is sleep. Sleep is very important. You have to sleep for at least 7 to 9 hours per day. When you sleep 7 to 9 hours per day, there is no organ that is going to be benefited. And if you deprive of your sleep, if you are sleeping less than 7 hours or 6 hours, that is not going to be damaged because of this sleeping habit. Sleep is very important. Sleep will reduce the stress. Sleep will regenerate each and every function of your body and part of your body, so that your PCOS is regulated. Next thing is after exercise you have to have stress free life. So nowadays women are going out to work and there is lot of stress at the workplace. So whatever you do, you have to try to reduce the stress. When there is high stress in you, hormone cortisol is produced and also adrenaline is produced. Adrenaline and cortisol are again fat depositing hormones. If you have high levels of cortisol, high levels of adrenaline, you will going to become obese again. So these are the 4 points you have to keep in mind to reduce your PCOS. We look into the complications of PCOS. There is only one final complication when there is elevated levels of estrogen in your body or in your blood. So it causes proliferation of endometrium. When the endometrium is continuously proliferated, it may go into cancer. So that is the important thing. You have to get treated for PCOS as early as possible to not to land into this uterine cancer.